So I'm very happy to present this phase 1, phase 2 data on 77 patients who've now had 3 years of follow-up for the treatment of Waldenström macroglobulinemia with Zanubrutinib, the second generation, very targeted, selective and potent BTK inhibitor. So in this Waldenström's subgroup of this large early phase study of 380 odd patients, we had 77 patients who had received the recommended phase 2 dose of Zanubrutinib, 320 milligrams a day. Most of them received 160 milligrams twice daily, and some of them received 320 milligrams once daily. Now, efficacy endpoints included response rates and progression-free survival. And we had a mix of patients with mostly relapsed refractory. 2/3 of them had relapsed refractory Waldenström's, and about a third of them had treatment-naive disease. And the overall response rate was 96%. And what was very interesting was that the very good partial response rate and a negligible complete response rate, because these BTK inhibitors, they don't get people into complete response. They just switch off the activity of the lymphoma. So the effective VGPR rate was 45%. And this VGPR rate increased over time. So we had about 20% at 6 months, over 30% at 12 months, and as I said, almost 45% at 2 years. And estimated 3-year progression-free survival rate was 80%, and the overall survival rate was 84.8%. So almost 85% of patients were alive at 3 years. Now, what was really interesting about Zanubrutinib in Waldenström's, and I certainly found this personally, having been involved in the Innovate study using Ibrutinib for Waldenström's and then been involved in this phase 2 study, I was already seeing that the adverse events, the contusions, the bruising, seemed to be a lot lower grade with the Zanubrutinib than with Ibrutinib. And we were certainly watching out for it, having been primed. The neutropenia rate was still quite significant, but the atrial fibrillation rate was a lot lower at 5%. And grade 3 diarrhea was less than 3%. And I think that's a really important side effect that affects patients' quality of life. So, not only were the response rates extremely impressive and improved with time, we were getting a suggestion that maybe this was a BTK inhibitor that, because it was so selective, had less off-target effects and fewer side effects for patients. And so we really set the scene for the ASPEN phase 3 study that followed.